This is Patrick Hamilton Walsh of the Life Is podcast, and I've come on here this evening to give you a quick overview into how I was able to get myself back to full health and full energy following a month of great discomfort catching the virus, which has become a global pandemic. The reason why I'm doing it in podcast format is because I've just come back from a walk, logged into my social media, and I've got a lot of questions from people around the world. So it's probably best that I explain it full, and this is the sort of best medium to do it. So let me take you back to December. I had just completed the Abu Dhabi Marathon. It was my fastest ever time. I got to the finish line and I could have ran for 10 more kilometers. I probably have never been as fit or as healthy in my entire life as I was at that day. And whenever the marathon finished in Abu Dhabi, myself and my wife went off backpacking for a while through Oman and Dubai and just having a nice time. You know, we went back to Sweden, of course, and had Christmas at Sweden, and then for the New Year's we flew to the Seychelles to just chill out by the beach and take it easy and sort of bring in the new year. 2020 I had a lot of great plans for 2020. So if you've ever been to the Seychelles, you'll know that it's quite a chilled out sort of couples type of island. And even though I talked to a lot of people, normally it was a week where it was just sort of myself and my wife chilling out in the day. We rented a house, so we weren't even in a hotel. So we were on the beach in the day, we were at house at night. Sometimes we went to a restaurant. Usually we cooked food for ourselves at the house that we had rented, just above the beach. And we didn't really talk to anyone or get involved with anyone. And that's quite unusual for us, because normally we have pick up a few friends or get involved with other people. Everything was going great. We celebrated New Year's Eve, and on the 2nd of January, I woke up at 2 a.m. and I could not breathe. I couldn't catch a breath. I was really gasping for air in a way that I just couldn't get oxygen to go into my lungs. I just couldn't get it in. And at this time there was no talk really of a global pandemic. There was noise coming out that something was going on in China, but there's a type of a SARS flu in China, and that was it. We went off and did our Christmas things. So it never crossed my mind for a second that this could impact me at that time. And a few days, it was basically the end of my holiday as far as doing any sort of strenuous thing was concerned. Up until that, I was running up and down the beach and relaxing and taking it easy. But from that day forth, I was actually in a stage where I would really, really slowly make myself down to the beach, sit there, have lunch and go back home, and it was a real struggle for me. And that was it. I was, as we left the Seychelles, we flew back through Zurich airport, and normally when I arrive at an airport, I go to the lounge and I have a cup of tea and maybe some fruit or a snack, some soup, before going on to get the flight. And we had 2 hours between our flights, and it actually took me 2 hours in Zurich airport to walk from one gate to the other. And this airport was completely empty because it was late at night. And I could walk 2 or 3 steps before I had to stop and catch my breath again. So that was the situation I was in just a few weeks after running my best ever time in a marathon. And whenever I got back to Stockholm, I had a project that I needed to complete by the 31st of January. And I'm very reluctant to take any type of medication normally. I don't drink alcohol. I don't smoke. I have a mostly a plant-based diet. I don't really have any bad habits. I'm in full health normally. And I had to complete this project, and because I couldn't catch a breath at all, I thought I must have some sort of serious chest infection, because I grew up as a chronic asthmatic. and I had never experienced this type of shortage of breath. It was something completely different, but I assumed it was something to do with asthma. So I got an antibiotic and I tried to take it. It didn't really do any job for me. But despite that, I just kept going anyway. I had to work around being tired, exhausted, and not being able to breathe to get the project finished, and I did. Still, coming up to the end of January, there was no thought in my mind that a global virus might have sort of impacted me in any way. It wasn't until March that, at least in Sweden, it sort of became relevant that there was a global pandemic based around the COVID-19 virus, and the city here went into not a lockdown per se like the rest of the world did, but people were encouraged to work from home and things like that.
I'm recording this podcast through Anchor, and if you're considering doing a podcast and you haven't heard about Anchor, then let me tell you, it's the easiest way to do a podcast. So let me explain. It's free. There are creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute the podcast for you, so it can be heard on Spotify, Apple Podcast, and many other platforms. You can make money from your podcast with no minimum listenership. And it's everything that you need to make a podcast all in one place. Definitely check it out. Download the app now from the store.
Because I'm an essential member of staff in the job that I have, I went into the office maybe 2 or 3 days per week, and of course the city was completely empty. It was just essential staff who were moving. And a few weeks into March, whenever this was sort of becoming the talked about news story, I seen a list of symptoms what this virus includes, and it was shortage of breath and these things, and I was thinking, I wondered, is that the thing that I had in January? But it can't be, because there was no mention of it, and they're just saying that it's sort of coming around now and coming out of Southeast Asia, and it went into Italy first. This is what it was in Europe, so it was more like a Chinese virus that actually went into Italy, and Italy was very hard hit. And we had an Italian friend here in Stockholm, and his parents were doctors, so he was a bit more freaked out about it than we were. But so despite that, I was now clear. It seemed to have sort of went away in me itself after about 2 weeks of struggling, and then another 2 weeks of just sort of winding down gradually. And the thing is, my wife was beside me the whole time. Obviously, it was winter in Stockholm, so we were spending a lot of time indoors and things. And she had no symptoms at all. So fast forward from March to coming up towards the end of June, and I find myself in a situation again where I'm completely feeling like I have either relapsed, caught it again. It's sort of been just germinating within my body or something. I don't know. I don't have a clue. And I'm really gasping for breath again. And I'm trying to do my best to sort of follow the instructions, stay home, keep away from people. We have a summer cottage, so I was sort of up in that, just myself, my wife, and just basically away from civilization, because we're so far out in the country in that place, we're not close to anyone. And in that first week where it came back to me, I lost 6 kilograms. And in total, I just lost over 7. But again, I'm quite a tall, skinny guy who was, even in June, I was preparing for the marathon in Stockholm, which was put back until September. So again, I'm quite fit, I'm quite strong. And I go to Karolinska Institute, the hospital here, and I get tested. And I go in, and they test me for the antibodies, and they test me for the the virus, and even though I'm struggling to breathe as I'm in the hospital, they're saying there's nothing they can do for me. So they take all the samples and they send me home again. And if I'm honest, in the month that followed that, there was 3 times whenever I thought I was dead. I thought like I have been going for long enough without any oxygen or any sign of oxygen going into my lungs, and I don't think I'll get through this night. And it's not, obviously it's not a nice thing to think that you're going to die through sort of suffocating yourself because you can't get oxygen into your lungs. And so that's why I had to go to the hospital, and I wanted to get checked out. And literally there was nothing. So they sent me home again. They says, well, we'll send you your results. And what came back was that I had the best case scenario, basically, as they say. I was negative for the virus, and I was positive for the antibodies. My wife also got tested, and she was negative for the virus and negative for the antibodies. So to sort of give people a bit of an insight into that, they're not totally sure what either of those means as of yet, but apparently it's the best case scenario because it means that I had it and my body has fought it off, and now I have antibodies, which means I don't spread it and I'm less likely to catch it. The fact that my wife was negative and negative means that she probably had T cells, which I believe her immune if she came in contact with the virus, her immune system just basically ate it up and burnt it off, and she had no need to create the antibodies. I'm not a doctor. I'm not professionally qualified. Please don't take any of this as medical advice or insight. I'm just telling you what I think. And if you're in any doubt at all, definitely please go to the professionals and the doctors who are working with this type of thing. So that's what I get back, and I'm still not feeling any better. And I'm trying. I take a lot of vitamin C. I take B. I take vitamin D. I take zinc. I take sodium bicarbonate quite regularly. I really have a healthy and clean body, and I was sort of up in the doses on that to try and get myself better, and nothing was working. So I was getting down. I was getting desperate, and I remember that the American president came out a few months before that and said that there was this medicine called basically hydroxy, and you know the rest. It's a HDC, we can call it. And he says he was taking that and he hasn't caught the virus. And as a backpacker who has travelled the world for many years, and I've been to many places with malaria and things, I had some of this HDC medicine. And although I don't like taking malarial medicines, I thought I have to give this a go. So I did a lot of research online, watched many videos, went to some reputable sources. And again, this is not medical advice. You need to go to your doctor and find out what you need. But what I needed and what I was willing to take a chance on was the fact that I had access to this medicine from my travels that I had taken before. I think it's like 80 years old medicine. It's been around. It's cheap. It's easy to get. And what I did is I did a course of it for 5 days along with zinc. So I took 2 tablets in the morning, 2 tablets at night on the first day. And then for the next 4 days, I took 1 tablet in the morning, 1 tablet at night. And I took 225 milligrams of zinc each day. So what I did is I took 75 mils 3 times a day, which was 3 tablets 3 times a day for me of zinc. And again, this is not medical advice for you. Find out what you need wherever your country is, whatever the dosages is of zinc and of this HDC. Go to your doctor, go to your pharmacist and find out what's available. I'm only telling you what I researched and what I came up with. And that's what I did. And the outcome of that for me was last Thursday I was out trying on an outfit and I was so exhausted and so out of breath just from trying on the first outfit that I had to sit down. And that was the final straw for me. I decided, okay, I'm going to take these tablets. I'm going to try it from tomorrow, from Friday. And I did. I was a little bit nervous about doing it because I wasn't sure if they would work, and also what these malarial tablets can do if I take them at that level. But again, I did it, and truthfully, for me, and I'm only talking about me and the way my body is and the fitness levels and health levels that I have, within 30 minutes, I felt a difference. I felt as if my lungs had went from having a chain wrapped around them and pulled tight to basically the chain being taken off, and I was able to breathe deeper down to the bottom of my lungs again. And that was within 30 minutes. And it felt like the energy had been turned on. If I had been working at 2% of my energy, it was almost like it was getting turned up to 10%. It doesn't sound like a lot to operate at 10% of the energy, but when you've been at 2%, you basically multiplied your energy by 5 times. And it felt like a lot to me. So, again, every person's different. How they do it is different. Whenever I took these tablets, I held them in my hands. I really set intentions and prayed over them, and I said, please God, let these work for me as well. You know, I set intentions. These are going to go into my body. They're going to work. They're going to be strong. They're going to make me healthy. This is what I did, and this is how I do it. I really set intentions for stuff like this. So maybe there's the psychological element of it. Maybe it's the sort of spiritual element of it that made me sick. But whatever it was, it worked. And I continued to take those tablets for the next 4 days, and I continued to take zinc still. But this is Saturday, which is just over a week later, and as I said, I've just come back from a walk where I've walked 10k today around the city of Stockholm, and I have been really appreciative of my life in the past week. My wife is away, so I'm going to all the museums I always wanted to go to. I'm going to cafes where I want to eat. I'm going to restaurants that I want to have my lunch, and I'm really feeling a revigoration and a real zest for life and an appreciation for all that I've been given. Because, as I said, 3 times in the past month, I thought I was dead. I thought I was just not going to get that air into my lungs. And again, I'm not trying to compare anything to any other person or say that this is the way to go. Maybe it was just pure luck and a big coincidence, and it would have went out of my system anyway. But that's what I'm telling you. It's how my past month has been and what my last 6 months have been like, as I've led into it. So the American president said that this stuff was helping him, and just because I had it, it was the last chance to learn for me. And I just want to say that I'm grateful for the ability to sort of share this now, because if I was to do a podcast in the past month, I would have been gasping and stuff, and you can probably hear it a wee bit on me already, but my breathing is a lot easier than it was, and I hope that helps some people. I hope it at least gives you a true insight from one person and one person's perspective of how they've got through it. And I hope that you and your family, wherever you are in the world listening to this, are safe and healthy, and I strongly suggest that you follow whatever the local norms are and whatever the requirements are locally, because we're all in this together. We've all come together as a global community on this, and in Sweden we've been the outliers. If you want me to do another podcast, then please leave it in the comments telling you about how things are in Sweden, where we haven't actually went into a lockdown. We've had a lot of commonsensical freedom, and the Swedes are quite good at that type of thing, where they sort of already have a social distancing society inherently, and it works quite well here. I don't think it would work quite as well in the UK or Ireland, which I have a lot of experience with, but it works here, and every society needs to do it the way they do it. But if you want me to give you more insight into that and some sort of things that aren't being covered in the media about people coming to live in Swedish hotels and stuff just to get used to the freedom, I can talk about that if you want. But for now, I want to keep this at around 20 minutes just so you can get a quick overview. But I wish you luck. I wish you a lot of health. I wish you a lot of protection. And God bless you all. And just, as I say, follow the doctors, follow the professionals, and most of all, just keep you and your family safe. And thanks for listening to this. Much love.